The way a horse eats is the reason why we have a lot of the problems that we have with their teeth. Their mouth actually grinds back and forth, okay? So this is the ripping and tearing portion of the mouth, the front teeth. That's where they grab the grass and rip and tear, okay? This is where they eat. So they actually grind the food back and forth, whether it's forage or whether it's grasses, pellets, grain, whatever it may be. They're going to grind it down with those molars until it's a fine mash, and then they'll swallow. Okay? That's when things are working perfectly. But if you notice, if you want to look at the skull and come up here and touch it and feel it and all that, you're more than welcome to do that, so you can tell what I'm going to tell you the next is that the lower jaw is narrower than the upper jaw. And because of that function of their anatomy, the lower jaw teeth, as they grind, tend to grow or develop really pointy edges on the inside of their molars, okay? And when you come up here, and I encourage everybody to do that, and pass them around, but they're getting a little old. I hate to lose any more teeth out of them, but you can come up here and feel how sharp these edges can really get. So that's the lower jaw. On the upper jaw, because it's wider and they grind this way when they eat their feed, the outside tend to get sharp. You got a slope on the teeth. Now what happens when you get these points or these sharp edges is, guess what's resting right in here? Is their tongue, right? Okay? So the inside of their tongue gets cut up. And this is a very common problem. It happens at any age, of course. Some horses are more prone to having or needing more dental work than others. You should take your horse in once a year and have them checked. They'll take the tongue out and outside of the mouth and they'll look, and you can look yourself. And be careful not to get bit, of course. But the inside of the tongue can have abrasions, and that's very painful for them. And so a lot of horses will actually roll their tongue out the side of their mouth when they're eating. They'll eat, I've seen them eat sideways. They'll try to drop it to one side or the other. They'll wad it up in little balls, spit it back out again, and re-eat it. Okay? They'll do all kinds of stuff, and I've got some handouts here. I don't sit here and read through the whole handout. That's for you to take home and take a look at. But in one of these handouts, it actually has a list of symptoms. But I've seen some strange stuff go on. Okay? Because of the way the upper jaw, since those teeth wear inside and get the edges on the outside, now they cause abrasions on the inside of the cheeks. Okay? And that is where you as a horse owner, if you're not, you know, you can be real careful. You can reach up inside the cheek area, get your little flashlight, let your horse open its mouth up, hopefully it will. And by this time you should be worming and doing all that stuff. You should be able to kind of take a peek. Or you can actually run your hand up inside the cheek area, between the teeth and cheek, and sometimes even feel the abrasions themselves. You can't see them. Or flip your hand around and see if it comes out bloody. Okay, I've had that happen. They've been so sharp and so jagged and worn that they actually come out. And it's like, ow. I mean, you'll tell when you feel these. This skull is from a 4-year-old horse, approximately, somewhere in there. I don't know the story. It was in a boneyard when my students brought it to me, so I couldn't tell you much about it in terms of anything other than the wear on these teeth is amazing. If you look at this jaw, you might notice it's offset. This is the bottom jaw. And I used to think that was because of the fact that it's gotten old and it's cracked right here. So I put it back in place. This is the horse's jaw. This is how it was, which would explain why the teeth are worn as badly as they are for such a young horse. So I don't know. I don't know what the story is with this horse.